Hello everyone. Today, we're diving into the world of a medication called Griseofulvin, commonly known by its brand names Fulvicin and Gris-PEG. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Griseofulvin is an oral antifungal medication primarily used to treat fungal infections of the skin, hair, and nails. This medication works by inhibiting the growth of fungi by binding to keratin, a protein in skin, hair, and nails, making these structures resistant to fungal invasion. Approved by the FDA in the 1950s, Griseofulvin is commonly prescribed for conditions such as athlete's foot, ringworm, jock itch, and fungal infections of the scalp, beard, and nails. It is effective against a variety of dermatophytes, which are the fungi responsible for these infections. Warnings: Griseofulvin comes with its set of precautions. It is not intended for use by individuals who have severe liver disease, porphyria, or are pregnant. The medication can cause harm to an unborn baby, so it's crucial to use effective contraception while taking Griseofulvin and for at least 1 month after stopping the medication. Additionally, individuals with a history of lupus should use this medication with caution as it can exacerbate the condition. Before taking this medicine. Before starting Griseofulvin, several factors need consideration. It's essential to inform your healthcare provider if you are allergic to the drug or any of its ingredients. If you have liver disease, lupus, or a history of severe allergic reactions, discuss potential risks and benefits with your doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. Women of childbearing age should use effective contraception during treatment and for at least 1 month after the last dose of Griseofulvin. Regular liver function tests may be recommended while on this medication. Side effects: all medications can have side effects, and Griseofulvin is no exception. Some individuals might experience common side effects like headache, nausea, vomiting, diarrhea, stomach upset, dizziness, or tiredness. If these effects persist or worsen, consult your doctor. There are also more serious side effects to be aware of, such as mental or mood changes, e.g., confusion, numbness or tingling of the hands or feet, or signs of infection, e.g., fever, persistent sore throat. Severe allergic reactions, although rare, can occur, with symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, and trouble breathing. If you experience any of these serious side effects or allergic reactions, seek medical attention immediately. Interactions: Griseofulvin might interact with other medications. It's crucial to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Specific drugs that may interact with Griseofulvin include barbiturates, warfarin, and oral contraceptives, as Griseofulvin can reduce the effectiveness of birth control pills. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Griseofulvin. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The dosage of Griseofulvin depends on the type and severity of the infection. Typically, it is taken once daily or divided into smaller doses throughout the day, with meals, to increase absorption. Treatment duration can vary from a few weeks to several months, depending on the site of infection. Always ensure you're taking the correct dose and never alter your dosage without consulting your healthcare provider. Avoid: while on Griseofulvin, it's advisable to avoid prolonged exposure to sunlight or artificial UV light, e.g., tanning beds, as the medication can make your skin more sensitive to the sun. Use sunscreen and wear protective clothing when outdoors. Additionally, it's recommended to avoid alcohol, as it can increase the risk of liver damage and enhance certain side effects. FAQ: many wonder about the age restrictions for Griseofulvin. This medication can be prescribed to children for the treatment of fungal infections, but the dosage will be adjusted based on the child's weight. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing: that wraps up our overview of Griseofulvin. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.